Namaste Vidya, Hamisha Kushal. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH University, Jaipur. In this series, we are discussing with the neurological disorders. In this series, today we will be discussing about the Bell's palsy and the facial nerve palsy. This disease occurs because of the injury or palsy to the seventh cranial nerve, that's the facial nerve. So in this lecture, we will be discussing about what causes the injury to the facial nerve, what are the various clinical features, what are the physiological changes that are occurring place, what are the features, clinical features, signs and symptoms with which the patient is coming to us, how can we identify the cases with Bell's palsy or facial palsy, what are the various investigative measures that could be performed in cases of Bell's palsy or facial nerve palsy individually, and investigations can be performed, and what is the treatment that has to be given in cases of facial nerve palsy or Bell's palsy. So let's start with an important topic of neurology, Bell's palsy. What is Bell's palsy? Bell's palsy is a neurological condition in which the function of the facial nerve, cranial nerve 7 or the facial nerve, is partially or completely lost. So the function of the facial nerve is lost, due to which there is the muscles supplied by this nerve loses their function. There will be loss of tonicity. It is a type of facial paralysis that results. We are talking about facial palsy. It is a type of facial paralysis that results in an inability to control the facial muscles due to the loss of function of the facial nerve. Facial palsy is occurring, due to which the facial muscles on the affected side loses their control, cannot be controlled by the facial nerve. The symptoms can vary from mild to very severe type, and they may include the muscle twitching. The symptoms can include muscle twitching, involuntary twitching. There can be weakness of the muscles, or total loss of the ability to move from one or maybe both sides of the face. So the nerve controlling the muscles loses its control, and due to which the muscles becomes lax, flaccid, and we are not able to control it on the. So this is the picture of the symptoms which are commonly seen. There is inability to close the eyes. There can be drooping of the mouth. The facial. This is the picture of the facial nerve and its branches. How the facial nerve is supplied to the part of the face. The lacrimal gland, the salivary glands. Due to which there is sagging. The facial nerve loses its function. Due to which there is sagging of the lower eye. The eyelid becomes down. There will be grouping of the mouth. With this side will sagging and going downwards. So the facial palsy, this occurs due to the injury to the cranial nerve, the facial nerves. These are the different branches of the facial nerve. We have auricular temporal nerve. We have temporal branches. We have facial nerve, post auricular branches. Zygomatic branch. We have buccal branch. We have mandibular or submandibular branch. There are multiple different branches. The cranial nerve, facial nerve, the cranial nerve 7, facial nerve, and the area supplied by this particular nerve. Facial nerve supplies all the muscles concerned with the facial expression. So, if there is any injury to the facial nerve, and the facial expressions are deranged, the normal look or appearance of the face is distorted. So, this is the detail of facial nerve. So, I believe we have already understood read this thing, or if not, then we can go through again your active and read it again. I won't be discussing these things again in practice of these class. Okay, but few important things I'll be discussing, like the facial nerve is submandibular gland, submandibular gland, and lacrimal gland, and trigeminal gland. So this is the trigeminal gland. So we don't need to go in detail because otherwise we'll lose the continuity of Bell's palsy. So what is the incidence of Bell's palsy? It is most common form of idiopathic facial paralysis. This disease is a very common form of idiopathic facial paralysis. Idiopathic paralysis is idiopathic because the cause is not. The injury can occur at various sites of the facial nerve that will be responsible for different symptoms that are produced in cases of facial palsy or Bell's palsy, but the exact causes are known. Therefore, this one is idiopathic. The annual incidence is 25 to 1 lakh annually. 25% per lakh population annually affected by Bell's palsy or facial nerve palsy. It affects 1 in 60% over a lifetime. all the ages and both sexes are equally affected. So there is no age specificity or sex specificity or preponderance to the development of Bell's palsy. The risk factors are pregnancy and diabetes mellitus. So the people who are the ladies who are pregnant have increased risk of developing Bell's palsy. Also, people who are having diabetes mellitus have a more incidence of developing Bell's palsy over the other individuals. The seventh cranial nerve supplies all the muscles in concern with facial expression. This I have already told you that seventh cranial nerve, the facial nerve, is responsible for the facial expression, for the maintenance of facial expression of all the individuals. What is the pathophysiology? The pathophysiology involves there is inflammation of the facial nerve. Facial nerve gets inflamed with mononuclear cells consistent with the infectious or immune cause. So any cause like any infections or any immune cause that causes the inflammation of the facial nerve with mononuclear cells. There can be infiltration of the facial nerve. There can be infiltration with the mononuclear cells. There can be inflammation due to any infectious or immune cause that is responsible for the development of facial nerve palsy. The herpes simplex virus was frequently detected major cause of Bell's palsy, facial nerve palsy. Reactivation of varicella zoster virus. In the chickenpox, we have studied that varicella zoster virus becomes when it affects the zoster virus, when it affects the children, then it is responsible for development of chickenpox, and in the later life when it gets reactivated, it is responsible for the development of varicella zoster or herpes zoster infection. It is the second most cause or the frequent cause because it affects the nerves. Therefore, it's the second most important cause of Bell's palsy. Increased incidence was reported among the recipient of inactivated intranasal influenza vaccine that was causing reactivation of latent virus. So in some of the individuals, it was reported that when the varicella intranasal vaccine was given, that was responsible for the activation of the latent virus that was present in the nose and leading to the development of Bell's palsy. What are the clinical features? The clinical features are of great variety. There is a great spectrum of symptoms that are present in the cases of Bell's palsy. The onset is usually abrupt. The symptoms come suddenly, the maximum weakness being attained by 48 hours as a general rule. So the symptoms, the infection affects in the Bell's palsy, the symptoms come suddenly, and within 48 hours, there is great weakness that is experienced by the patient. There is pain behind the ear that precedes the paralysis for a day or two. So before the paralysis, it is observed that the patient complains of pain behind the ear a day or two before the onset of symptom of paralysis. The taste sensation may be lost unilaterally because the facial nerve also supplies the taste buds. So the taste sensation may be lost unilaterally, or hyperacusis may be present. Hyperacusis means increased sensitivity to noise can be present. 80% of the patient recover within a week or month. So this is a very good thing that of all the patient, if 100 patients are getting affected by Bell's palsy, almost 80% of the patient recover within a week or months. If the evidence of degeneration after 10 days indicates axonal degeneration. If the patient is not recovered within a week or a few weeks or months, then after 10 days, it is, if there is any sign of denervation, that it indicates that axonal degeneration has taken place and now nothing much. Now these are the clinical features of Bell's palsy. This is loss of wrinkles because the facial nerve provides a shape to the face. There is loss of wrinkles. This side is getting affected. The left side is getting affected due to the facial nerve palsy. So there will be loss of wrinkles. There will be wide capitular fissure, happy foramin's, excessive lacrimation other than the ears, absence of nasolabial fluid. This fluid is absent, and there is drooping from the mouth. What is Bell's palsy? There are certain signs and symptoms like headache, and these symptoms we will discuss again. This will come again. So I will discuss it again. So other clinical features include inability to open or close your eyes on the affected side. The affected side muscles do not obey the will of the actual damaged facial nerve. There is drooling of saliva from the mouth. The one side of the mouth is becomes drooped down, and there is drooling present. Difficulty in eating and drinking because the mouth cannot close properly. Therefore, from one side there is progressive loss of food and water that comes out. Therefore, there is difficulty in eating and drinking. The patient is not able to make any facial expressions because of the facial nerve palsy, such as smiling and frowning. That is in this slide we have seen this. Facial weakness is present and muscle twitches is present in the face. There is dry eyes and dry mouth that is present in the patient. The patient also complains of the headache. I told you that these symptoms will come. The headache is present and there is a great sensitivity to sound that is known as hyperacusis. Irritation of the eyes on the involved side is present. There is complete interruption of the facial nerve and the stylomastoid foramen. So if the facial nerve is completely interrupted at the point where it enters, that is the stylomastoid foramen, it paralyzes all the muscles of the facial expression. So अगर उसको जहाँ से एंटर होती है वहीं पे कंप्रेशन हो गया है, इंटरप्शन हो गया है, तो उसके बाद जितने भी नर्व्स आगे हैं उसकी सभी जगह जो भी सप्लाई है, that all part will be interrupted. So there will be unilateral, क्योंकि दोनों साइड से सप्लाई होती है, patient will have supply from both the sides. तो अगर एक साइड से इंटरप्शन हो रहा है तो उस एक पर्टिकुलर साइड का सारा पोर्शन पैरालाइज हो जाएगा उस मसल से. Paralyze all muscles of the facial expression. कोई भी facial expression patient नहीं बना पाएगा. There will be loss of entire facial expression on the affected side of the facial nerve compression or the interruption. The corner of the mouth droops down and the creases and the skin folds are affected. The forehead is unfurrowed. जो सलवटें हमारे सिर पे आती हैं वो unfurrowed हो जाएंगी and eyelids will not close on the affected side. Look, this I was talking about. यहाँ से अगर ये जो enter हो रहा है, यहीं पे अगर compression आ गया, तो जितने भी nerves ये supply हो रही हैं, इन सब में ये सारा का सारा आपका loss of sensation, loss of function हो जाएगा. The muscles will not act properly. Upon attempting the closure of the lids, the eyes on the paralyzed side rolls up. Usually जब आप आंखें बंद करते हो तो आंखें नीचे जानी चाहिए, पलक बंद होनी चाहिए, लेकिन क्या होता है इसमें अपोजिट हो जाता है. जब आप बंद करने की कोशिश करते हो खुल जाती है. That is known as the Bell's phenomenon. The lower eyelid sags and falls away from the conjunctiva. The tear spills over the cheeks. आंखों में से आंसू को पानी टपकता जाता है. The food collects between the teeth and the lips because of the lack of control over the facial muscles. जो खाना है दांतों और cheeks में फंस जाता है. And the saliva dribbles from the corners of the mouth. Saliva है वो dribble करता जाता है corners of the mouth. So there is heaviness and numbness of the face. The face becomes heavy and numb. Their sensory loss is rarely demonstrated and the taste remains intact. Sensory loss जो patient को हो जाता है, that is rarely demonstrable and the taste remains intact. Taste usually intact रहता है, but अगर ज़्यादा involvement है तो taste If the lesion is over the middle ear portion, अब lesion कहाँ है इसके हिसाब से सारे symptoms आ रहे हैं. We are getting symptoms according to the side of the lesion of the facial nerve. So if the lesion is there on the middle ear portion, the taste is lost. अगर middle ear portion पे आ रहा है तब जाके taste का loss होगा over the anterior two-thirds of the tongue and on the same side of the lesion. If the nerve to the stapedius is interrupted, there is hyperacusis. तो अगर जो nerve stapedius तक जा रही है वो इंजर हुई है, उसका डैमेज है तो hyperacusis होगा. Sensitive to the nerve sounds increases very much. The lesions in the internal auditory meatus may affect adjacent auditory and vestibular nerves, causing deafness, tinnitus or dizziness. So अगर lesions internal auditory meatus में हो रहे हैं, तो facial nerve जो supply कर रही है internal auditory meatus में, वहाँ पे अगर इसका lesion होगा तो may affect adjacent auditory and vestibular nerves. So vestibular nerve, vestibular जो area होता है that is responsible for maintaining the body balance. और auditory आपकी सुनने के लिए responsible होती है. तो अगर इसमें damage होता है, so the symptoms of deafness, tinnitus and dizziness are observed in the patient. The palpebral fissure becomes narrowed and the nasolabial fluid deepens. Nasolabial fluid है वो deep हो जाएगा क्योंकि आपकी जो muscles of contraction उसकी power खत्म हो जाएगी. The attempt to move one group of facial muscle result in the contraction of all. That is known as symphysis. इसमें दिखाता हूँ कैसा होता है. इस तरह से देखिए आप आंखें जैसे एक तरफ की बंद करने की कोशिश करेंगे तो दूसरी तरफ से ज़्यादा contraction. इसमें आप देखिए लेफ्ट साइड में आपको प्रॉब्लम है जिस वजह से सारे के सारे एक्सप्रेशन चलेगा. एक साइड में जब आप मूव करते हैं तो बहुत ज़्यादा मूवमेंट हो जाता है बिकॉज दूसरी साइड से अपोजिशन नहीं होता है. एक तरफ खींचते तो खींचता ही चला जाता है, दूसरी तरफ से बिल्कुल अपोजिशन नोटिफिकेशन में पास है. ठीक है. This phenomenon is known as synkinesis. So there is facial spasm that is initiated by the movements of the face with tabla. So that is known as hemifacial spasm. अभी जो आपने फेस का देखा था फिर इमेज में देखा था that is known as hemifacial spasm. The facial spasm initiated by the movement of the face. थोड़ा भी movement किया तो facial spasm हो जाएगा. If the fiber connected to the orbicularis oculi, orbicularis oculi कौन सी आपकी मुंह के चारों तरफ की जो मसल्स होती है वो डिस्टॉर्ट होती है. In the patient the orbicularis oris orbicularis oris is the oral muscles and orbicularis oculi are basically the eye muscles. Eye muscles का जो involvement है वो fibers अगर destroy हो जाते हैं और as I muscle fibers इंजर्शन अगर डिस्टर्ब होता है तो इसकी वजह से आपकी जो आई है वो क्लोज नहीं हो पाती प्रॉपर्ली और ऑर्बिकुलरिस ऑरिस जो माउथ की मसल्स हैं उनका भी क्लोजर नहीं होता है. So if the innervate the lacrimal gland, if the innervation of the lacrimal gland is disturbed, anomalous tearing, crocodile tears happen हैं इसमें क्योंकि अगर innervation of the lacrimal gland disturb हो जाता है तो अपने आप से ही पानी निकलने लग जाता है आंखों से आंसू आने लग जाते हैं तो पेशेंट को बोला जाता है कि आप तो मगरमच्छ के आंसू बहा रहे हो आपको कोई तकलीफ नहीं होगी आंखों से आंसू आ रहे हैं. So that is due to the innervation of the lacrimal gland getting disturbed. It occurs with any activity of the facial muscles. कोई भी activity नहीं उसके साथ से आंखों में आने शुरू हो जाता है. The jaw opening and closing causing closure of the eyelids. जैसे ही आप jaw open करोगे वैसे ही आपकी आंखें बंद हो जाएंगी. On the side of the facial palsy, that is known as jaw winking. जैसे ही मुंह खोला वैसे ही आपकी आंखें बंद हो जाएंगी on the side of the pupil side, that is known as jaw winking. तो ये हो गया, ये सब चीजें इसमें आती हैं. If the fiber is connected to orbicularis oculi innervate, so this we have already studied. Now differential diagnosis. What are the different conditions that can resemble the case of Bell's palsy or facial palsy? The patient can have Lyme's disease, infection with Borrelia burgdorferi. We will be discussing infectious diseases, Lyme's disease. So this resembles with Bell's palsy, Ramsey-Hunt syndrome, severe activation of the herpes zoster that we have already covered in the chicken pox and herpes zoster. Sarcoidosis can be there, Guillain-Barré syndrome that resembles the Bell's palsy. It can be leprosy. It can be connected to Sjogren's syndrome and amyloidosis. Sjogren's syndrome already covered. Acoustic neuromas can be there by local compression of the nerves, and tumors that invade the temporal lobe can be there. Now, what are the various investigations that could be done in the cases of Bell's palsy? So basically, this is a typical presentation. देखते ही पता चल जाता है. Once you see the patient, you can diagnose. This is a on-spot diagnosis that this patient is suffering from Bell's palsy. देखा और देखते ही पता चल जाता है. No risk factors or pre-existing symptoms of the other causes of facial paralysis. यहाँ पे जब आप इंक्वायरी करते हो तो there is no other cause of facial paralysis. Absence of cutaneous lesions of herpes zoster in the external ear canal. इसमें कोई आपको नहीं देखने को मिलेगा herpes Bell's palsy. Normal neurological examination with the exception of facial nerve. Facial nerve को छोड़ के बाकी सब कुछ normal है. Facial nerve में दिक्कत है तो Bell's palsy होगा. MRI shows swelling and enhancement of the facial nerve in idiopathic Bell's palsy. There is mild cerebrospinal fluid lymphocytosis. तो ये सब अगर आप चेक करोगे तो mild lymphocytosis आपको इसमें देखने को मिलता है. Electromyopathy may be of some prognostic value. तो electromyography मसल्स की आप electromyography करा सकते हैं जिससे कि आपको थोड़ा बहुत हिंट मिल सकती है. This is the disease that is related to the facial nerve. Now, what is the prognosis? हमारे पास में पेशेंट अगर आता है Bell's palsy का तो what is the prognosis? वो पूछता है आगे क्या होगा? तो हमें पता होना चाहिए what is the prognosis of the case of Bell's palsy or patient. The presence of incomplete paralysis in the first week is the most favorable prognostic sign. जब हमारे पास में कोई पेशेंट आता है और वो देखता है कि incomplete paralysis है, तो that is a good sign because वो कुछ दिन में कुछ हफ्तों में पूरी तरह से arrested हो जाएगा. With or without treatment, most of the individuals begin to get better within 2 weeks after the initial onset of symptoms. तो बहुत अच्छी बात है कि Bell's palsy में जो symptoms होते हैं वो अपने आप से ठीक होने लग जाते हैं within a week after the initial onset of the symptoms, and most of them recover completely. Around 80% of patients recover completely, returning to the normal functioning within 3 to 6 months. Recurrence is often reported in 7% of cases. So इसका prognosis वैसे तो better होता है, लेकिन अगर patient ठीक नहीं होता है तो permanent disability हो जाती है. What is the management? जो लोग ठीक नहीं हो पाते तो फिर उनके लिए आपको क्या करना है? What is the management of the cases that have not recovered from cases of Bell's palsy? So use of tape or paper to depress the upper eyelid. आंखें खुल जाती है, आपने बंद करने की कोशिश करी, खुल गई तो उसका टेप चिपका दो. So tape to depress the upper eyelid during the sleep. तो आंखों में सोते समय आप टेप चिपका दो ताकि आंखें नहीं तो ड्राई आई हो जाएगी और कॉर्नियल एक्सप्रेशन हो जाएगी. टॉपिकल ऑक्यूलर थेरेपी आप दे सकते हैं जिसमें कि आप आर्टिफिशियल टीयर्स या ड्रॉप्स डालने के लिए पेशेंट को दे सकते हैं आपको सोते समय. मसाज टू द वीकेंड मसल्स. तो मसाज करने से देयर विल बी इम्प्रूव ब्लड सर्कुलेशन इन दैट पर्टिकुलर मस्कुलर पोर्शन एंड हेल्प यू गेटिंग बेटर विद अ फ्यू टाइम. तो जैसे ही Bell's palsy होती है तो बोला जाता है पेशेंट को आप मसाज वगैरह करें तो ब्लड सर्कुलेशन प्रॉपर हो जाए क्योंकि आपके पास कुछ हफ्ते हैं जिसमें कि आप वापस इम्प्रूव कर सकते हैं. The glucocorticoid therapy, which includes prednisolone, is given on the daily doses to shorten the recovery period and improve the functional outcome. And in case of the viral infection, antiviral drugs can be prescribed to the individual. So this is the basic management of the case of Bell's palsy, facial nerve palsy. In the next lecture, we will be starting with seashells. So this was all for today. This session was powered by Digital Version 2.0 University. We hope you are satisfied with the digital session. If you have any query, please mention it in the comment box. It was all for today. So thank you very much. This was Dr. Ravi, and I hope you have understood a few things from today's lecture. Now I require you to go to the portal and just download the e-notes, the PPT, the word file that I have uploaded. And you can also see the questions that you have to answer. And even if you don't understand anything, you can ask me here on the comment box. So this was all for today. This was Dr. Ravi signing off for now. We will meet in the next lecture tomorrow. Thank you.